Or the person may say that few days back neighbor's wife, she had an argument with my wife, and because they are planning something against me. So patient may give some justification, some logical explanation, which at times would appear logical. So that means the delusion is systematized. So degree of systematization would differ in patients, and this may even in fact vary over time. And this systematization we see is more common in older patients. Many times patients having schizophrenia or other such psychotic illness with delusions, and over the course of time they may have this systematized delusion. And patient whose delusions prove persistent, so person having persistent delusion again may have this systematization of delusion. So this was about primary and secondary delusions. Now let's talk about the content of delusions. Now again, content means what the person is thinking, what is the content of that delusion. Again, first of all, let's first differentiate. This is different from primary and secondary delusion. When we discuss primary and secondary delusion, we discuss primary are the delusions which we are not able to understand how they develop, and secondary delusions we discuss that they occur because of some abnormal phenomena. Now, content of delusion can occur both as primary or can occur as secondary. So now we are more interested in knowing the content of the delusion. Again, when you read literature, when you read history of psychiatry, you may find there may be an endless list of the content of delusion. But we are going to discuss some of the common ones, some of the ones which we see in our day-to-day practice. So let's discuss some of the important content of delusion. Now, when we talk about the content of delusion, they may be determined by patient's emotional, social, cultural, or biographical background. For example, let us say a person who is an engineer is working in an MNC. Let us say he may have a delusion that there may be certain aliens from another galaxy. They're trying to communicate and want to harm him. So again, if you see the content of the delusion, we are able to see it is related with the background of the individual. And let us say another person who is a farmer, he may have this delusion that there is some evil spirit on the tree, or there is some black magic going on around me. So again, we can sometimes understand the content of delusion related with the background of the individual. Now, delusions, what we have observed that they have changed over time. So delusions which were present 100, 200 years ago, they have now changed over time. So earlier, the delusions were like they've been interfered by spirits, by black magic, and now they've changed into being interfered by the internet. So again, we see that the content of delusion has changed over time. Let's talk about the first delusion, that is a delusion of persecution. In fact, this is the most frequent delusion which we encounter in our practice. Of course, if you've seen any patient having delusion, this is one of the common delusions which the person has. So what is a delusion of persecution? Here the patient believes that their lives are being interfered with from outside. Someone from outside is interfering their life. And this is more often, they feel that is to harm them rather than giving any benefit. So it is more in a harmful way. Somebody wants to harm me, somebody wants to kill me. This is delusion of persecution. Now, these delusions, sometimes the person may even believe that they or their loved ones are about to be killed or are being tortured. And many times when the person has these delusions, they're about to be tortured. Sometimes it may be secondary to some somatic hallucination, that they are feeling some somatic hallucination in the body, and subsequently they develop this delusion that they are being tortured. Now, when we talk about these delusion of persecution, they may occur in context of primary delusional experience. So they may occur as a primary delusion, or they may occur in context of any auditory hallucination or some other perceptual changes. For example, patient reports that he's hearing voices of the neighbors talking about him, and eventually may develop a delusion of persecution. So this is one of the context how these delusion of persecution may occur. In fact, in schizophrenia, many times this occurs that after an hallucinatory experience, the person develops delusion. Then again, as we have discussed, bodily hallucinations can also lead to these delusions. Experience of passivity, someone is controlling my thought, such experiences again eventually may lead to delusion of persecution. And also mood changes. Sometimes patient having depression may claim somebody or my neighbor wants to kill me because I am a bad person. So again, they may also occur in that context. Now, there are various forms of delusion of persecution. Let's discuss some of them. So, there is delusion of reference, delusion of prejudice, delusion of being poisoned, delusion of influence. So, let's discuss them. First is delusion of reference. Now, as the name suggests, reference means everything is occurring around me in reference to me. So, delusion of reference means that patient knows that people are talking about him, slandering him, or spying on him. So very commonly we see this, one of our patient, we were walking and he was sure that two strangers, which we saw, they are talking about him. We tried to inquire, how do he know? We cannot hear what they're saying. These are strangers, we have never met, but he was convinced they're talking about him. So much so that he went there and grabbed their collar. Why are you talking about me? So this is delusion of reference. Now, sometimes it becomes difficult to ascertain whether there is a delusion of self-reference or these are self-reference hallucinations. Many times patient says that, I know somebody is following me because he is hearing some voices. So again, it's very important to differentiate whether these are delusions of self-reference or whether these are any self-reference hallucination. So always when you're trying to see what delusion the person is having, also try to differentiate whether is it because of any self-reference hallucinations. Now second is delusion of prejudice. Delusion of prejudice, as the name suggests, here the person believes that he is being slighted, is overlooked, is passed over in favor of someone else. Many times patients come to us with such delusion. They may feel that in their office they have been neglected, they have been overlooked because there is someone new in the office and he wants to take my place. So there may be a delusion of prejudice which may occur at times. Then delusion of being poisoned, again not an uncommon phenomena. Again, we often see this kind of delusion. It's a type of delusion of persecution. Here the patient believes that somebody is poisoning him, and sometimes the patients with morbid jealousy. So sometimes a patient having morbid jealous, they believe that their spouse is poisoning them. And often the delusion of poisoning are explanatory delusions. For example, patient feels that mentally and physically, things have changed. And only way to account for this is that their food is being poisoned. So many times these delusion of poisoning are explanatory delusions. And in fact, in some cases, they are based on olfactory and gustatory hallucination. Many times, when they report that, the smell of the food is, different, it is strange. And sometimes, they may have the gustatory hallucination, the taste is very different. And subsequently, they may develop this delusion that there is something being mixed in their food. So there is a delusion of being poisoned. Next is delusion of influence. Again, these are basically a logical result of experiences of passivity in context of schizophrenia. So many times patient having passivity phenomena, someone is interfering their thoughts, may develop these delusions that their lives are being influenced from outside. So here basically their passivity feelings may be explained as a result of hypnotism. They may say because of hypnotism or because of some evil possession, witchcraft, radio waves, etc., TV. These are basically to influence the person. They are influencing the lives of the patient. So this is a delusion of influence. So these were some forms of delusion of persecution. Now the interfering agency in the delusion of persecution, again, it may be so many things. Sometimes it may be any animate or inanimate object. It may be other people or machines. So for example, patient may say, my family members, my neighbor, my office colleague, they are interfering with my life, they are planning to harm me. Or it may be systems, organization, institutions such as religious bodies or government bodies. They are against me, they are after me. The CBI, the FBI, they are after me. So sometimes it may even involve these institutions or organization. And sometimes patient may just say that there is a vague influence. So patient may say that I know somebody wants to harm me, I'm not very sure who it is. So sometimes the patient may just say that he knows somebody is against him, but he may not be able to explain. So there may be just such a vague influence as well. Now, when we talk about delusion of persecution, they may be seen in schizophrenia. Again, very characteristically, we may find patient having schizophrenia with delusion of persecution. And of course, we will also find certain other symptoms of schizophrenia. Then it can also be seen in affective psychosis. Again, it can be seen in depression. It can be even seen in mania. And again, when we see many times these delusions will be colored with the mood state of the individual. For example, in depression, patient when has a delusion of persecution, patient may even justify those delusions. So there is often, most of the time, they are justifiable. For example, patient says that my neighbor wants to kill me because I am a very bad person and I deserve to die. So they are able to justify at times. It's very uncommon that we see that these are not justifiable in depression. And also they can be seen in organic states. For example, in delirium tremens, patient may have these delusion of persecution again, and when we see these patient affect, maybe very stark terror may be there. So other features of the phenomenology may also be present. So they may be present in various conditions, even other conditions like delusional disorder, these may be present. Now, persecutory overvalued ideas may also occur in patients with litigious type of paranoid personality disorder. Many times when we see paranoid personality disorder, these patients, they may sue other people, they may sue doctor, they may sue other people. So they may have this litigious type of paranoid personality disorder, and many times we see that persecutory overvalued ideas may be present in these individuals. Now, also many times in clinical practice, the word paranoid is used for persecutory. Again, it's very important to understand this word paranoid. When we talk about, in Greek, it means by the side of the mind, and it is used in the 19th century for functional mental illness in which delusions were most prominent. Hence, when we use this term paranoid, here it has a meaning of like paranoia or delusional. So paranoid not always mean only persecutory. So that is why if you see, when we talk about schizophrenia, we talk about paranoid schizophrenia. Paranoid schizophrenia does not mean that patient has only delusion of persecution. Paranoid schizophrenia, we say patient can have any delusions and or with hallucination. So it's very important to understand that the word paranoid not necessarily only means persecutory. In fact, it is more like paranoia or delusional. So the meaning is delusional. So again, very important. Sometimes we confuse this word to just being persecutory. Now let's talk about the second delusion, that is delusion of infidelity. Now first let's understand what is the English meaning of infidelity. Fidelity means faithful. So infidelity means that my partner or my spouse is not loyal or is not being faithful. So delusion of infidelity, sometimes the term morbid jealousy is used, but again this is a misnomer, as a patient has a delusion of jealousy and may also have delusion of infidelity. Again, morbid jealousy may occur in various ways. So it is not always necessary that morbid jealousy means delusion of infidelity. Rather than a delusion of jealousy would mean delusion of infidelity. Again, it's very important, but sometimes this term is used interchangeably. Morbid jealousy is used with the delusion of infidelity. So morbid jealousy, in fact, as described by E. in 1950, it may be manifested in various forms. It can be infested as a delusion. It can be also infested as overvalued ideas or as depressive affect or even as anxiety state. So again, morbid jealousy may occur in various forms, but sometimes the term is used interchangeably with delusion of infidelity. Now, before the onset of this delusion of infidelity, often the patient has been suspicious, is sensitive, and is mildly jealous. And gradually it may occur in the form of delusion of infidelity. So many times we see that spouses or partners who have developed this delusion of infidelity, if we take a detailed history, there may be some mild suspicion, mild jealousy, sensitivity may be present even before that. So there may be pre-morbid mild jealousy attitude may be present, and that may subsequently gets exaggerated into delusion of infidelity, especially in disorders such as in affective psychosis. In affective psychosis, this may be seen. Now, these can be seen both in organic as well as in functional disorders. So let's discuss some of the important disorders where it can be seen. It can be seen in schizophrenia. It can be seen in organic brain disorders, especially example such as punch drunk syndrome in boxers. And often it is associated with the impotence. So because of repeatedly getting hit on the head, repeated head trauma, subsequently the person develops impotence and there is this delusion of infidelity which may develop. Also, very interestingly, it may be associated with alcohol dependence syndrome. Again, very important. One of the very important substance associated with this delusion of infidelity is alcohol. And often in a clinical practice, in fact, when you see a patient with chronic alcoholism, many times we see that these patients may have developed delusion of infidelity. And it can be seen, of course, in affective psychosis. Again, in other conditions like delusional disorder also, they may be seen. Now, severity of these delusion may fluctuate over time. And so, as we discussed, gradually it may start, and eventually the person may develop delusion of infidelity, and the severity of the symptoms also may fluctuate. Now, during a marked disturbance, when the person has very severe symptoms, the person may interrogate the partner continuously. Many times we see that for hours and hours throughout the night, the person is just interrogating with the partner, and partner has said so many times, trying to convince, the person does not get convinced. So they may interrogate the partner continuously. Often they interpret common phenomena as evidence of infidelity. So often they may tell, there may be certain stains on the dress of the victim, and they may say that these are signs, stains of semen. So again, they would try to search for evidence, and they may interpret common phenomena as evidence. And behavior may progress to violence. So many times we have seen that they may be violent towards the partner. In fact, even sometimes can even lead to murder. So they are more violent on the partner rather than the supposed rival. So rather than with whom they're having affair, they basically have more of violence towards their partner. And mostly we see that it is men having a violence on women, and in fact it may be one of the commonest motivation for homicide. So again, delusion of infidelity is important. Many times acting out behavior may be seen with this delusion. It may occur with or without other psychotic symptoms, and sometimes these symptoms may even be resistant to the treatment. Often we see that even despite treatment, the symptoms may not totally go away. Now, Enoch, in 1991, he regards the nature of relationship between the two partners as key aspects. So let's try to understand some of the important aspect of the nature of relationship, which is commonly seen in such a delusion. Now, jealousy is directed usually towards the sexual partner. So the partner with whom the person is having sexual relationship, usually it is directed towards that partner. Now, the deluded person, let's see some of the important characteristic of the deluded person, is very much attached to and often emotionally dependent on the other person. Usually we see the person who has developed this delusion, they are very emotionally attached to their partner, to their spouse. And they may have been promiscuous in the past. So maybe in the past they might have had some extramarital affair or some affair, and subsequently they expect that even the spouse may be having such behavior. So again, this may be seen in deluded person. Also, it is seen that they may have become impotent and they project the blame on the partner. As we've discussed, like in punch drunk syndrome, many times impotence is seen and they may project this on the partner. In fact, many times this theory has also been proposed, like in alcohol patients who develop delusion of infidelity because of chronic use of alcohol, they develop impotence, and that subsequently is the reason behind developing delusion of infidelity. Also, sometimes it is seen that they may have some homosexual fantasies towards other men with whom he is relating his wife. So for example, the person may be having some homosexual content or homosexual fantasies towards the neighbor, and subsequently the person may develop delusion of infidelity. My wife is having an affair with the neighbor. Again, this may often be seen. Now, the victim also, it is seen that often may be more sexually attractive than the deluded person. So the victim may be a young wife or a young husband, more attractive than the person who has developed this delusion. Now, delusion of infidelity has also been given different names such as Othello syndrome, and Kraepelin has given this term sexual jealousy, and also Mullen has classified it with disorders of passion. That is, disorder of passion means there is increased sense of entitlement. So he has put under this disorder of passion 3 categories. One is morbid jealousy or delusion of infidelity. So here basically the person feels that he is deprived of the loyalty which is their due. So the loyalty which should be there, they are being deprived of that loyalty. Then second is querulent, that is they're annoyed at infringement of their rights. And even erotomania is, according to Mullen, is a disorder of passion. In erotomania, it is basically driven to assert their rights of love. So here erotomania, patient believes that someone else is in love with the person. So we'll discuss erotomania separately. So this is just, you can remember Mullen basically classified disorders of passion, and in that he classified morbid jealousy as one of that. Now let's talk about the next delusion, which is delusion of love. Delusion of love, also known as fantasy lover syndrome, also known as erotomania. Again, love is not a delusion. So what is love? Of course, we're not discussing, we'll not go into the definition of love. Love is when we say we love that person. Delusion of love is when the person claims that someone else is in love with me, he's mad about me. So that is delusion of love. So patient is convinced that some person is in love with the patient. So someone else is in love with the patient, although the alleged lover may never have even spoken to them. So this, occurs sometimes that the person whom they are referring to might not had even spoke to them ever. Still, they are convinced that that person is in love with me. And often we see that they may send victim letters of unwanted attention of all kinds. So they may send letters, text messages, emails to the person. And even if there is no response, it's not that, when they don't give a response, they're disheartened. Many times we see if there is no response, then they may claim that their letters are being intercepted by other people, and the other people are maligning to their lovers, so they are not letting the patient reach to the lover. So again, they may give such responses when their letters or their emails or text are not responded by the victim. Now, it is seen to be more common in women than in men. And again, there is a term used by Hart, that is old maid's insanity. Again, it is, similar to delusion of love. Here also sometimes delusion of persecution may offer, even also develop in this. Then there is also a variation of erotomania that was given by de Clermont, and that is also, we call delusion of love as de Clermont syndrome. So what are the characteristics of de Clermont syndrome? Here basically, again, typically it is seen in women who believes a man who usually is of older age and higher status is in love with the patient, and victim has usually done nothing to deserve her attention and may even be unaware of the person's existence. Many times we see that patient claims that a superstar, a film actor is in love with me, and again it appears that actor might have never met this patient, but they claim that he's in love with me. So someone of older age or of higher stature may be involved, and sometimes he is a well-known public figure and quite remote from the patient, as we have discussed. So this may be seen in de Clermont syndrome. Now, occasionally isolated delusions are seen in abnormal personality states. So many times in abnormal personality states also, such delusion would occur, and only delusion of love is seen. Sometimes it may be seen in schizophrenia. So schizophrenia in fact may begin sometimes with this delusion, and eventually this delusion become more diffuse, and hallucinations may also develop, and other symptoms of schizophrenia may also develop. And these may also occur even in manic depressive psychosis, even in bipolar disorder. They may be related with the mood states. So this is delusion of love.